Hi, my name is Jill Trigger. I'm an instructor at City College of San Francisco.
And I'm Tim Berthold, and I'm also a teacher here at City College of San Francisco. And we wanted to talk with you a little bit about the concept of rolling with resistance, which is a motivational interviewing concept and skill that you can use in the moments when clients are feeling ambivalent about making a change to promote their health, meaning that they have mixed feelings or mixed thoughts about it, maybe doubts, maybe they're questioning. Can I really quit smoking? Do I want to quit smoking? That's the moment in which this technique is used.
The thing with rolling with resistance, I think, is that getting to that point with a client where they actually are in touch with what they're worried about, that's actually, you've accomplished something if you've gotten to there. That's not that you've now ended up trapped in some corner that's bad news, that's good news. It's a normal, healthy part of anybody's behavior change to get to the point where they're sort of having to weigh and balance the risks involved versus the benefits. So what you do with that ambivalence is what's really going to determine whether this becomes a productive part of the relationship you two are building. Ideally, you don't take that resistance as a sign that you now need to convince your client of anything or argue with them about their fears. This would be the moment to ask them more about what's going on. Why are you concerned? Or even to say, I understand why you are concerned. Can you tell me more? So explore it rather than seeing it as something that you need to fight.
Yeah, I mean, I've certainly had those experiences with my own physicians where I'm trying to change my diet or I'm trying to exercise more. And I'm trying, but it's not going so well. And instead of really listening to me and exploring that, they jump into lecture. And that never goes well for me. It's not something that helps me to better understand what's going on or to move forward. And that's what rolling with resistance is about, is just get out of your own way. Remember that ambivalence is natural. It's a common part of the change process. And ask questions to help the client talk more, just naturally, calmly, in a relaxed manner about what's going on. They want to quit smoking, but they also are really having a hard time. What's that about? Let them tell you without judgment, and let them find their own way forward in terms of what they want to do next. Change doesn't have to happen all at once or right now. It's a process. And again, we're asking you to be just a little bit more patient with the client's process in the way that you would want your CHW or your physician to be patient with you.
So much of what you're doing with a client is about building their own self-efficacy. And if you try to tell a client that they shouldn't be ambivalent, that they shouldn't feel how they're feeling, you're actually undermining your own goals. Your client is hoping to learn how to manage their own chronic condition or how to improve their own life. Let them struggle through whatever this ambivalence is and find their way out of it themselves. Your role is helping them explore it, not helping them avoid it.
Yeah, give up any tendencies that you have to control the outcome or the decisions. Rolling with resistance, motivational interviewing, they're all client-centered concepts. And what we seek to do is to give back power, control, and authority to the client. That's really what rolling with resistance is about.
Yeah.
You.
Exactly. I'm not sure there's anything more to say except that that concept, rolling with resistance, instead of emphasizing the resistance part, I think we're really sort of saying, emphasize the rolling part.